the opioid fund's critically important for counties. And so KCO, thought it was important enough to bring on somebody, and we did in a partnership with NACO, the National Association of Counties, our uh, sister organization at the national level. They partnered with a group called Vital Strategies. And as a result of that partnership with NACO and us, we were able to bring on Lauren Carr. Many of you have met Lauren at our conference and at other events. She's spoken already a number of times, but she's going to be leading the conversation today. Before we do that, I do want to thank a couple of our guests that are with us today. As I mentioned earlier, I was speaking to Executive Director Evans, Chris Evans, who's the new Executive Director of the Kentucky Opioid Abatement Advisory Commission. That is under the direction of the Attorney General's office, and we're glad to have him and his Deputy Director today, Jesse Holliday, who I mentioned earlier. Again, we do have folks from the Vital Strategies team that are on. I'll let Lauren introduce those here in a minute, but they're great partners for us. Just a couple of quick reminders since I'm kind of doing this kickoff. I'll do the formalities too. If you are working on getting some training credit with DLG, the message. Keep your cameras on, all of that. If you have questions for the speakers, especially with this many people on the Zoom, it's best to just type that in the chat. We'll have folks that are kind of watching the chat for questions and help get those to Lauren or anybody that's part of the presentation today. As always, these are recorded, and we always send these out to the registrants afterward in a link so you can watch this again if you miss a part of it or something. So with that, again, just my thanks personally to each of you. I hope you know our team here at KCO certainly doesn't take for granted the work you do and the opportunity we have to support you in every way we can. And this is one of those areas where it's a new area. It's still uncharted territory for a lot of you and us. So we're kind of learning this together about how to really make these funds work the best for your counties. And again, I hope today will just be one in many conversations that we'll be having with you all about how to help you be successful with the use of these opioid settlement dollars. So with that, I'm going to turn it over to our specialist on team now, Lauren Carr. So Lauren, thank you.
Thank you, Jim. I'm going to go ahead and share my screen. All right, does everybody see everything? I have to double check technology sometimes, so.
Looks good.
Looks good. Okay, well, thank you all. I'm very excited about this opportunity to share with you my expertise and the access to the resources that we have across the country. Kind of like Jim said, we do have some special guests on this call. So I first do want to introduce the Executive Director of the Opioid Abatement Commission, Chris Evans, and give him some time to talk about kind of their vision. I know they just had a commission meeting and just anything, Chris, that you would like to speak to this audience.
Thank you, Lauren. I appreciate that. First of all, and I will be brief, first of all, I want to say thank you for the opportunity and say thank you to all of you for the work that you're doing. It's great work, it's important work, and it's vital to communities growing and trying to make sure that people have a safe and stable community to live and grow and work in. So I want to thank you for what all of you do. Just a little bit about the commission I feel comfortable that most of you have heard, but some of this, but again, the Opioid Abatement Commission was established to guide and review and disseminate the state share of the settlement funds, that 50% which comes to the state for use. The Opioid Abatement Commission is designed, it's a 11-member panel, 9 of which are able to vote, 2 are non-voting members, made up of a diverse group from different places within the state and also representing those who have lost and others. And so the funds basically come, or the requests come to the commission, and that group is able to review, disseminate, and guide funding levels from the state funds. What's important really about the commission and the things I just want to make sure that that's clear is we're trying to ultimately make sure that all the work that we do in the commission and in the Attorney General's office is geared towards saving lives. That is the driving factor of what we do, why we do the things that we do, and what we support, and why we ask questions about the things that we're doing. Our whole goal is to help support people who are doing the work to save lives. And we recognize the often gritty and long hours that people put in to do those things, but that's what we're here to support. I tell people that there are a couple of key principles that we're using in trying to do that. Is we want to make sure that we collaborate. We want to make sure, and that's the great thing about the partnership with KCO, that we collaborate in everything that we do, that we make sure to reach out. We don't let silos or walls get built up around what we do. We also want to make sure that there is an accountability piece, that this money comes from loss and from suffering. And we want to make sure that everything we do and interact, that there's an accountability process to make sure that the money's being spent the way it's supposed to be spent. The third leg is the transparency. We want to make sure that people understand what we're doing, what's happening. And we want to make sure people have clarity on the process. Again, that we're transparent and open. We're not doing anything that needs to be hidden or that should be sheltered from people. So right now we're really working on methods and ways to make sure we're transparent. And then the fourth thing of kind of principles of what we're doing is sustainability. We want to make sure that things that get supported, and we understand that these aren't profit building ventures. We understand these are to help people and help communities, but we want to make sure that we're planting seeds that are going to grow. We want to make sure that the things which are funded, when people are proposing them, when people are looking at them, that they look at what's a long-term way to make this go. The money, although is a lot, is coming out over the course of approximately 15 years or so. And so people need to understand or be able to look at, hey, we may have received funding this year, but we might not next year. And we want to make sure that people build in that thought process of how does this move forward. And so that's really kind of the basis of what we're doing. The vision of what we do and what we look forward again is that collaboration piece. But we also want to be very thoughtful and strategic and use data to also help us figure out where to help people and how we can make things better. So we want to reach out, we want to talk to people, we want to figure out how we can be smart about doing things. And I will tell you the best version of what I've heard, that what the work is that we should be doing actually comes from Lauren, and that I'm sure she's wondering, what am I going to say at this point in time? But at a conference, and I hope I'm not stealing one of your phrases, but she told people, look, this money should be used to change the trajectory of overdose deaths in the Commonwealth. And that by far is the best description I have heard of what this money is supposed to do. So Lauren, I want to publicly thank you for that, because I have attributed that to you on a couple of occasions that you haven't been there, but that's the goal of what we're trying to do at the commission. And so again, we hope in the future to make things more transparent, easier for people to be able to understand, and also a little more clear guidance in how the process works or what you have to do to move through the grant process that goes through. So again, thank you very much for your time. I appreciate this opportunity. And Lauren, Jim, if there's anything else, I'm happy to address it, but I don't want to take up too much of your time.
Thank you for those kind words, and we are eager to be working with the commission as we try to streamline this process and help counties navigate these funds. So during this session, we are going to give you a brief overview of the current settlement dollars, how KCO can assist you during this process. I will be going over some settlement uses, the reporting requirements, and then I will open it up to questions and answers. KCO staff attorney Rich Ornstein will be chiming in during this presentation. And then when we open up for questions and answers, I have partners from Vital Strategies legal tech team, Kate Bolton and Derek Carr, and they can answer how they have assisted this work in other states. Before I begin, I need to share how I got here. I grew up in a broken home filled with addiction and childhood trauma. When my older brother Justin started using substances, I didn't understand why. I couldn't understand why. I often found myself in a whirlwind of emotions as I watched my brother struggle with opioid use disorder. Despite our shared past, I began to realize that each person's journey through pain and trauma is deeply personal and complex. Justin's words often echoed in my mind. I'm just trying not to feel sick. I just want help. You don't understand. This was in 2011, a time when access to treatment, healthcare, and recovery resources were not where they are today. My brother died of a fentanyl overdose, and it was the first time I had ever heard of that drug. It was then that I understood that addiction was not a choice. And as I navigated through my own emotions of confusion, grief, and pain, I vowed to do whatever I could to help those that experience substance use disorder. At the end of the day, dead people don't recover. When a fatal overdose occurs, that person doesn't get a chance to help heal, to rebuild their life, to mend the broken relationships, or find peace with themselves. It became clear to me that understanding, empathy, and support were all essential in addressing addiction. I made it my mission to advocate for compassionate and evidence-based approaches to support people who use drugs, educate about the complexities of substance use disorder, and offer a helping hand to those in need. Every person struggling with addiction deserves a chance at recovery, a second shot at life. There are things that we can do to prevent substances from happening in the first place, but equally important, there are things that we can do to keep people alive when they are actively using, and it starts with us. These settlement funds provide us an immense opportunity and responsibility to get it right. So with that in mind, what is opioid remediation? This is the definition that is used in the settlement. These funds are designated instead of like a drug strategy, but it is really the healthcare and the approach of that individual. States are required to spend at least 70% on future opioid remediation. So this addresses the misuse of the disorder, the related disorder, and also those injured from the opioid epidemic. Future opioid remediation is everything outside the ability of the state to reimburse for the past expenses. And it's completely aside for future intervention. So kind of think about this as future things or ways that you could supplement programming that you already have or things that you could do. So just a really brief overview of the settlement. The national or big global settlement, you kind of hear it as the big three, and those are the three pharmaceutical companies and Johnson & Johnson. So Kentucky received about $478 million from that. And you all, the counties usually should receive the first checks were sent in December of 2022, and they will be paid over the next 18 years. With this, it also establishes the Opioid Abatement Trust, which 50% goes to the commission and then 50% goes to local governments. Now, there are additional settlements that are coming. There's multiple lawsuits with pharmacies, and so such as Allergan, Walgreens, Teva, Walmart, etc. And there is still pending litigation, even from a new one like Kroger. And so the thing about that is we will be helping streamline that communication. So if there are additional settlements or anything like that where counties need to know, we are going to be helping assist in that funding and in that streamline approach. What can I do as technical assistance? How can I help counties as we navigate this process? You can ask just general settlement questions. We can work on strategic planning, go about allowable uses, spending plan development. We have a resource guide on our KCO website, and we're also going to be monitoring to make sure that the expenses, that the investments that you all are making it has a return in really helping those individuals. And we're also going to be sharing peer examples. So sharing examples of what other counties are doing, maybe best practices, what is working, a promising practice. And so we understand that you all are experts in your community, but lean on us as we are experts in this field. We have many resources available to us, and this work is being done not only across the state, but across the country too. And so we can work and really learn from others with that. So with that being said, what it is not, KCO is not positioned to provide legal advice, but only recommendations based on the understanding of the state law and the applicable settlement agreements. So with that being said, one of the questions when I watched the previous webinar was like, will these situations change, or will the regulations change? Because ARPA and if you were used to ARPA or CARES Act, those kind of changed those regulations. It's important that these settlement funds are not from a federal or state. They are from a settlement. And so it is outlined not only in Exhibit E, but it's also outlined in the state statute on how these funds can be spent. All right, so I'm going to go over reporting requirements real fast. And so all local counties that receive 50% that receive half of the share must submit a quarterly certification form. It is important that you have to submit this form even if you have not spent the funds yet. The Opioid Abatement Commission, Advisory Commission can inspect the records. They can up to 5 years, so it's really important to keep all the documentations. And now the certifications are due every quarter. We are working to try to help streamline that process, because right now it's a paper process, but we are working with that and to make it as less burdensome on the counties, but also help get the information that we need to make sure that these funds are being spent in the correct way. So here's just an example of the form. This form is available not only on our website. This PowerPoint that will be sent out has links to it, but it's also available on the Commission's website as well. The forms must be completed by an authorized individual and notarized. It was kind of asked to me, who is an authorized individual? It is whoever the fiscal court decides. So also kind of to reiterate, these funds go through the fiscal court. So the fiscal court is the one that designates these funds. And so whether the fiscal court, whether it's the judge executive or the treasurer or whoever is the authorized individual to complete this form, it is just, it needs to be completed at the end of every quarter. All right, so kind of just the statute details. This is the statute that kind of lays out the certification requirements, and that the funds that are being dispensed are consistent with the criteria, which is KRS 15-291 in subsection 5. There's about 29 interventions that you can invest these monies on, as well as Exhibit E. There's you need to keep a list of the funds and the receipts and the amounts, a description of how the funds were used, and then any other information that the commission may request. One of the things that Rich had mentioned at the last presentation was just documentation. This is a new realm for counties and all of us, so we don't know what all information that they need. So just kind of keep track of all of the documentation, and especially if you grant out these funds, which I'll talk about in a little bit. But if you grant out these funds to a third party, making sure that you are responsible for getting those metrics back and figuring out how those monies were being spent. So local funds can have, local governments can have funds withheld for non-compliance. Non-compliance, we do not know what this means yet, but we don't know if a local government will have to pay back the funds or could lose future funding or anything like that. But if the funds are not spent in accordance to the statute and the settlement agreements, the local governments can be, the funds can be withheld. So I kind of wanted just to reiterate that, that we don't know how this is gonna come to fruition, but it is in the statute that local governments can have funds withheld.
Hey, Lauren, can I jump in real quick?
Yes,
This
please.
is one of the things that we discussed last week at the magistrates conference. And you know, I looked at the faces and the names on this Zoom. And some of these our folks have been around for quite some time. And I want to make sure everybody understands that when Lauren says that funds can be withheld, that funds, in theory, the settlement administrator could withhold or try to recoup funds that are misspent. This isn't like ARPA, where things changed, or maybe we had a friend in DC that could put in a few good words and try to get something fixed. This is one of those deals where I think we want to be really, really careful that these funds are spent properly so that you don't have to repay anything back or have funds withheld to get you caught up. Unlike ARPA, where many of you got millions and millions of dollars, in many cases here, you're getting 100,000, 120, 130, right? Up front. And well, that's a significant sum of money. It's not going to change your county. That losing these funds or having to repay these funds could seriously detrimentally hurt your county. So I can't stress enough that this is so much different than what we've done in the past. And I think it's very, very important that you are very careful, very frugal with how these funds are spent. Thank you, Lauren.
Thank you, Rich. And you're welcome to chime in at any time with your wisdom. I appreciate that. All right. The next, I'm going to talk about the Exhibit E, which is in the national settlement, and then I'm going to talk a little bit about the KRS statute. So Exhibit E is a non-exhaustive list of suggestions of how to spend the opioid settlement funds that qualify as opioid remediation. It's a non-exhaustive list, meaning that there's guidelines, but it really needs to stay within these kind of areas. And so some of the core strategies is access to naloxone or other known as Narcan, medicated assisted treatment, other ways known as methadone, Suboxone, Sublocade, Vivitrol, services for pregnant women and parenting, expanding treatment for neonatal abstinence syndrome. And some more of the core strategies is expanding the warm handoff programs and recovery services. So there's, if your community has a local recovery center, or if you've heard of Voices of Hope or different things like that, warm handoff programs and recovery support kind of helps those individuals that need those wraparound services. So that is one of the core strategies, helping those individuals as they navigate and build recovery capital. Treatment for incarcerated population. Now the treatment is substance use related treatment. Prevention programs, expanding syringe service programs, that's working with your local health department, and evidence-based data collection to make sure that the money that we are using really has an impact and a difference in the individuals. And I'm going to go a little bit into detail about the allowable uses. So there's, kind of 5 broad categories, everything from prevention, harm reduction, treatment, recovery supports, and planning. So I'm going to go into detail and with each one of these. And then also, this PowerPoint has links. And so when we send it out, it will have links to different resources as well. So some of the prevention ideas, I started a drug-free communities grant. And so I'm very familiar with prevention, but K through 12 education programming, that could be any evidence-based programming. It's really, life skills is a very good one, but it really robust that risk and protective factors. Stigma reduction campaigns. Kentucky has a really good one, Unshame Kentucky, where it just shares stories of individuals that have been affected by opioid use disorder or this epidemic. support for foster care and other caregivers. And so that could be with grieving children or grandparents that are raising grandchildren, or any of those kind of supports to have that prevention aspect. And there's a lot of information with adverse childhood experiences, which is ACEs, and childhood trauma that Kentucky has done. And it really talks about having those resiliency factors and bolstering that youth, and so that they can navigate their ACEs. And so, at the end of the day, we can't change what happens in somebody's home, but what we can do is we can build that youth up and have them have the tools that they need to navigate life. Harm reduction, I'm going to talk a little bit about harm reduction too. So harm reduction is a set of practical strategies aimed at reducing the negative consequences associated with drug use. Harm reduction is also a movement. It's was something 5 years ago when it was approached to me. I will 100% be honest. Well, we are afraid of what we don't know. We have this opinion or things like that, but harm reduction really, it meets individuals where they are at, but it doesn't leave them there. I work direct client service through a local health department, and I really saw that impact from building that connection with individuals and helping them in recovery. And so working with your local health department and expanding syringe service programs, whether that be funding that they need to make their program more robust or get people in, or even connecting to services. Overdose education and naloxone distribution. So this could be providing Narcan training at a workplace setting, or it could be at a community event where you're giving Narcan and that overdose education. And it really empowers individuals to understand that, overdoses are occurring at the end of the day. We did have a decrease in Kentucky of 5% last year, but one of the biggest increases was our individuals in our Black communities. They had the biggest increase in overdoses. So making sure that getting Narcan in the communities that need it, and that kind of rolls into community-based naloxone distribution, whether that is just supporting it in any forms or capacity, and then also jail, prison, or jail-based warm handoff program. So giving individuals, when they are released from jail, Narcan. A lot of times overdoses occur when somebody is released from jail, and they go back to their coping mechanism that they knew, and their tolerance have changed. And so there is overdoses are very high among that population that gets released. So any kind of overdose prevention in the jail setting, and that kind of goes into harm reduction. So as far as treatment.
Hey, Lauren, I'm going to pop in real quick if you don't care. This is Jennifer. We have a question in the chat. If you can't see the chat, I'll pop in and answer it, or ask it, I'm sorry. But from Magistrate Blanton. Magistrate Blanton, do you want to unmute and ask the question from the group? Or I can ask it. Basically, he's asking if we'll be developing an example of a step-by-step process or plan for accepting proposals from qualified agencies, and kind of basically a guidebook.
That is one of the things that we are working on, kind of an MOU or RFP process, because we understand that counties might have community partners that are already doing this work that they can assist in these funding. And so, but an RFP kind of helps navigate individuals that are asking for funds that might not have the experience or the criteria to assist in that. So yes, that is one of the tangible materials that we are trying to work out, and also kind of some contracts with nonprofits. So that is, thank you for that question, and that is something that we are going to be working on. As far as for treatment, it's programs and services that specifically designed to train and assist in the complexity of substance use disorder, substance misuse, and co-occurring substance use and mental health conditions. Different examples of this is withdrawal management, residential treatment, outpatient treatment, treatment for those with co-occurring and mental health. And also, I wanted to highlight one way that organizations are doing this is they are bringing in peer supports or mental health professionals in a first responder role. And so whether it's a police navigator or a deflection specialist or a quick response team, they are kind of trying to take a different approach with individuals that have substance use disorder or co-occurring behavioral health as well. All right. Recovery support. So this is kind of really to help build that recovery capital, whether it is recovery housing, support those wraparound services. Maybe it is to just help with transportation or peer support or childcare or workforce development. So really trying to give those individuals the tools that they need to improve their health and wellness and live self-directed lives and to reach their full potential. And so there's different opportunities for this too, but that is just one of the strategies. And kind of leadership and planning there, I kind of want to reiterate, there is no timeline to spend these funds. I encourage you all to form a steering committee, talk to existing coalitions or advisory groups that are already doing the work, trying to get a community needs assessment, see what your community needs, and you might have those gaps, and these opioid abatement funds could meet those unmet needs. So whether that is helping with transportation or helping provide childcare so parents can attend outpatient treatment programs or anything like that. So you can kind of look at what needs you are, but you have expertise in your community. And so really lean on that. But if you don't even know where to start, please reach out to me and lean on me through this process. And I can help navigate those partnerships and give you all some help in those regards. And we are working on a request for proposal, and also it's really important to think about sustainability on these projects. Instead of just a one-time use fund, how can you utilize these funds and they be sustainable when you are going forward? These are some funding projects that were outlined in the KRS statute. Again, I'm kind of, it's almost like repeating myself, but you can kind of see how these all kind of tie into the opioid remediation and really tie into connecting individuals to those services that they need. And so intervention, treatment, recovery resources, crisis stabilization centers. There's a wide range of training and education for audiences. So whether that means that your staff needs Narcan training or needs to be trained in crisis or anything that can expand their knowledge on helping individuals with substance use disorder. And also they're supporting pretrial services that connect people to evidence-informed treatment. I know there's a county that has invested in that, and they have really seen some really good results for that. And then also any other project deemed appropriate by the opioid abatement by the commission. So if not to give the commission any more, but if you think that their project does not align with it, you can write to the commission and get some kind of guidance for that. So reimbursements, this is now 70% has to be spent on future opioid remediation, and about 15 of that 30% more than likely has already been spent on lawyer costs and litigation and things like that. So there's about 15% that can be spent on reimbursement cost, and that is the outpatient and residential treatment services, including those that are incarcerated, emergency response services provided by law enforcement in an opioid-related incident. And so,
Hey, Lauren,
yes.
before we go on to the next steps, and if you saw me last week at the magistrates conference, this is going to be a bit of a repeat, right? But I know a lot of you all, and Lauren and I discussed it, a lot of you all have already looked at 15291 sub 5. But if you haven't looked at 15291 subsection 5, that's really the list of how you can spend the money, right? Because this is what the state has passed, what the state has said is acceptable. It says it in the statute, it says it in the regulation. So it really wouldn't hurt. I'll be honest, I'm a lawyer. I get paid to read statutes, and I don't enjoy reading statutes. I know none of you all do either, probably, right? But if you go pull subsection 5, or if you email me or text me, I'll send you a copy of it. That really gives you an idea of how the funds can be spent. Because a lot of the questions Lauren gets, a lot of questions we got, Jennifer and I have received over the last year or so, is how can we spend the dollars? Take a look at 291 sub 5. It really will help you narrow your focus as to how you want to spend these funds. I mean, we're going to have ideas. I know our partners are going to come up here in a second and talk about some of the possibilities out there, but make sure you look at those statutes. They really, or that statutory subsection, it really does answer a lot of your questions. In many cases, it's the reason why we often say, no, you really can't use the money for this purpose, because how do you fit it in this portion of the statute? Thanks, Lauren.
Thank you, Rich. So we are kind of in this process. I've heard the analogy that we are flying a plane and building it too. And so please be aware of us that we are working as fast as we can to get you all the information that you all need. So there are some exciting things coming up. As far as a toolkit and dashboard, even from our national partners, there is going to be able to, that has an indicator and different things like that. We're working on our online resource library, which will be on the KCO landing page. We will be reaching out with a baseline survey just to kind of see where counties are and what you all need, and then also following up with those tangible materials. So whether that be an RFP or an MOU or a contract or even an interlocal agreement, things like that, we are coordinating and trying to offer those services to you. And then we are also going to be increasing opportunities for learning and best practices now that I am on board and here. I'm eager to provide that hands-on approach, help the counties as they navigate this. And yeah, and so in closing, and before I open it up to questions, I do want to reiterate the importance of the work that you all are doing and that you've already done, but there's still so much work ahead. But you don't have to do it alone. As leaders, you have these life-saving tools and resources in our community with these opioid abatement funds. You all are the experts in the community, but you might not know where to start. So lean on me, our resources, and the expertise in this field. We have the opportunity to change how we approach the topic of substance use and provide services to those that are struggling. By collaborating with local organizations, we can create a support network that can truly make a difference in people's lives. Our combined efforts can pave a way for a brighter future and sorry. Our combined efforts can pave a way for a brighter future where individuals struggling with substance use disorder can find the help and services that they need to overcome their challenges. We now have the power and the resources to bring about positive change and create a safer and healthier community. Now I welcome any questions that you all may have. Any questions or comments, I'm going to move it over to the next slide. I do have some just kind of some general Q&As, but if anybody has any in the chat, again, I have myself, our staff attorney, Rich Ornstein, and then 2 partners from Vital Strategies, their legal tech team, Kate Bolton and Derek Carr. And I can go ahead and ask some of these questions, and then kind of we can walk through it. And if anybody has any more or just comments or concerns, please feel free to chime in. So,
Lauren, this is Tom Simmons. Can some of this money be used through drug court? The individuals that are in drug court, can it be used to get them daycare for those that are working, or send them to treatment or things like that?
I know that I cannot pay for drug court because drug court is already funded by the AOC, but if it is a supplanting, or it is a supplement to that program, so where you are providing maybe childcare for those individuals that are in that facility, and it ties back to that opioid abatement, that would be Rich, wouldn't you think that that would be a allowable expense?
Yeah, so Tom, I think what we're talking about is, and by all means, anybody feel free to correct me if you think I'm wrong from the AG's office. But my recollection of our conversations last week was that if you're adding something to what you all are currently doing, that may very well be acceptable, Tom. If you're already providing this service and you want to keep it at the same level, the answer is probably no. If you want to increase the number of people you can serve with childcare, that would be acceptable. Again, if you've not been providing childcare assistance, and this is being related to drug court and the opioid issue, I think it's probably would be acceptable.
I don't think they're providing any of that yet. I mean, maybe through social services or something, but I was just thinking maybe through drug court, if there were some issues that childcare would help, or some additional counseling or something, and we would get a request from drug court if that would be possible.
If I could,
Let's take a look at them.
Rich.
Go ahead.
If this is Jessie Halliday,
Great, Jessie.
we had a conversation with AOC last week, and I think that what AOC has asked of their drug court judges is just to confer with their drug court, their specialty courts manager at the AOC level, so that they can assure that it's not supplanting something that AOC is already funding, or subject to another grant that they're already receiving. So I would say that if you work with your drug court judge to work with the AOC to see how you could supplement, those may very well be things you could support at the local level.
Lauren, it looks like Brittany has her hand raised. Brittany, if you'd like to ask her a question.
Yeah, thank you. I'm glad Mr. Simmons brought that up. So one thing that my name is Brittany Harrington. I work for Pathways, a community mental health center in Northeastern Kentucky. And we have reentry projects in 8 Kentucky counties that we have partners with in and out of our service region. And something that comes up often are like barrier relief funds. So funds that are used to relieve the barriers to access to care, access to treatment. And I was really thinking about, would it be possible for a treatment center or a community nonprofit to apply for funds for general barrier relief as long as they fell under and were reported as being used on the things that fell under the statute, such as IDs. Childcare is a huge barrier to a lot of people seeking treatment and care, recovery housing or affordable housing. What I hear, and we present to fiscal courts about our reentry project in all of our service counties, and what we hear consistently across the boards is our fiscal courts are nervous and they would really like an application process. And I know you guys are working on that. Yeah, so, and I don't want to muddy up what I said. So would it be possible to apply for barrier relief funds generally and then report them under the statute as being used in compliance? Like, I don't, there's just so many things that fall under that, from IDs, an $11 cost or a $22 cost, to childcare, to housing, which is one of our bigger costs. Am I making sense?
This is Jessie from the commission again. I think that you would want to document what is being requested, and so if you're creating a barrier relief fund, that you would say that would be used for IDs, housing, you would want to specify the categories and make sure that they fit with the statutory, what's statutorily allowed.
Yeah.
So like, for example, we have said you can't buy a vehicle. That doesn't mean you couldn't partner with someone to provide transportation vouchers, but you would want to make sure that the barrier relief that you're offering does not conflict with what the statute says can be spent on, if that makes sense.
Yeah. That's great advice. Thank you. And I also want to thank you for the clarification on prevention, and remind everybody, fiscal courts a lot of times, most of the times, fund a lot of law enforcement activities that happen in our communities. And law enforcement's idea of prevention is a lot of times a lot different than like recovery prevention. So I really appreciate that. So thank you guys so much.
Lauren, we also have another question. I don't know if you can see it. Magistrate Miller asks, can this be used for an AA type faith-based group called Celebrate Recovery? Magistrate Miller, if you want to pop on, you can. You're welcome to unmute if you have any additional comments there.
I don't really have any additional comments. We just have two of the Celebrate Recovery groups that work with addicts of all types. And there's two of them in our town, and they've been asking if they're being able to be reimbursed or helped with any of the opioid abatement funds.
I believe that those would be allowable expenses as long as it's tied back to the opioid use disorder, and you have that tie, and that you're not, they're not taking these funds to supplant what they were already doing. And so if they could expand their programming, so if they could service more individuals or have another night or anything like that, I feel confident that those funds would help, but it just can't go to replace, if that makes sense. You can't just, yeah. So think about this as expanding what you already have instead of replacing. And I think that is a good question on that. Thank you.
Thank you so much.
Okay, we have another question from Tara Shrewsbury. What about providing mental health for jails if it's not something we already have? Tara, if you want to unmute and provide a little color there, you're welcome to.
Yeah, I was just asking about, that's not something that we've ever been able to provide before, is any kind of mental health, whether it's through telehealth, having like a psychiatrist to come in, once a month. I don't know, what that would look like. It's just something we've never been able to afford and wasn't sure if that's would be an allowable use of those funds.
I believe that it has to have that substance use treatment too. Now it can address co-occurring, but whether you contract to bring in a provider that can address those individuals' needs, or a telehealth service, I think that is an appropriate use, but it really focuses on substance use disorder and helping with that treatment. But as you all know, a lot of individuals have co-occurring substance use and behavioral health issues. So, and Derek and Kate, you can feel free to chime in at any time if there's anything that I'm misspeaking on that you think.
Nope, that's exactly right. You got it.
Okay, I'm going to go through these other questions and then maybe you all there will be some more questions in the chat. So can you all work regionally with other counties? I think that is yes. There's not any one of these counties there's not a lot of funds. I mean, yeah, you're looking at millions of dollars, but spread out over 18 years, we need to make the most use of our funds, and especially in rural areas, we can collaborate and try to find that best practice. I know that some organizations are working out of their local ad districts, or you might have already regional coalitions that are doing the work. So just kind of partnering with those, and they can probably let you know what their unmet needs are or how to address these issues. Can you lose the funds if not spent correctly? I think that I want to reiterate that is yes. We do not know what that is going to look like, but it is statute that these funds have to be spent in regards to the statute and the distributors, the exhibitee. Do the funds have to be spent by a certain amount of time? No, there's no you spend it or lose it, but we do think that you all need to be working on a comprehensive plan, not an 18-year plan, maybe a 1 to 3 year, or I would say probably a 3-year comprehensive plan on how to utilize these funds. Will the allowable uses change? We do not anticipate the allowable uses change unless it changes by statute. And if that does, we will let you all know. What are other counties doing? We will be advertising, or not advertising, we'll be promoting different best practices and different organizations all across the state that have invested these opioid abatement funds and evidence-based and best practices, or even promising practices. And so this really gives an opportunity to be innovative in the regards of in opioid remediation. And so the other is, can you subcontract with a third party or nonprofit? Yes, you can. It is important though, and I'm going to reiterate that the fiscal court is responsible for these funds. So if you do subcontract with a third party or nonprofit, I would make sure that the fiscal court does their research, make sure that you have an application or a contract in place. And so you know what metrics they are, or what services they are providing. And so if once audits happen or anything like that, you can kind of show, and I'm just going to give an example. We gave $1,000 to this coalition. They were able to serve 15 additional youth in their grandparents raising grandchildren, or whatever. But you really need to get those metrics. And if you are subcontracting with a third party or nonprofit, and that's even as a case in a jail or a facility, if you bring somebody in to provide treatment, just to make sure that you get those metrics of how many people are served and different things like that.
Hey,
Hey, Lauren, I'm gonna pop in here. Oh, go ahead, Rich. I'm sorry.
So Lauren, one thing I want to make sure, and this is something we spoke to Jesse about last week, if I recall correctly. You should never, county, just in general terms, should never be just making a flat out donation to a nonprofit corporation. When you want to get money to a nonprofit, like Lauren was just saying, you need to enter into a contract for what they are going to be providing the county, right? There has to be that public purpose involved. No doubt, if it satisfies 15291, there's a public purpose involved. But before you give the money, you got to do the things on the front end. And on the front end, you need to get that agreement in place. I mean, we can try to help you with that. I think we're going to look at some things to try to at least give you some sort of a model or something you can plug your purpose in, but it needs to show what it is, right? And you want to get that contract in place ahead of time, not just because 15291, but because of our Constitution, because of all sorts of things. So definitely partner if you want to partner. Some of your nonprofits have a better feel for how to make some of these things happen, but you want to make sure that you're contracting first. And then, like Lauren said, there's something tangible that the nonprofit can report back to you so that we know the money was spent properly. And when I say we, I work for KCO, so I work for our counties. But we as county governments, we need to be able to satisfy an audit. We need to be able to satisfy other things as well. And the only way to do that is to have a contract and get back what you're supposed to get back. Not to mention the Attorney General's office very much wants to be able to show how these funds were used and how they've benefited our Commonwealth. Thanks, Lauren.
Thank you.
I do have a question in the chat from Treasurer Ann Melton from Ohio County. This is a good one. Ohio County has a program to help inmates in reentry upon release from jail. These are inmates with drug issues. Currently, this program is funded with ARPA funds. When these funds run out, we had planned to use the opioid funds. Will this be allowed since it was already in place?
I think that when you were thinking about this, and those ARPA funds are expiring, and so you would not be able to, continue that service without funding. So kind of like if a grant had lapsed. It's a reentry program to help individuals with opioid use disorder. I believe that was I'm trying to read the question and answer it. Yes, I believe that as long as there is not funding, I mean, because the ARPA funding was very specific. And so if it is like a grant ended, you could continue those, but a reentry program is an allowable use of the opioid abatement funds. In some, I believe, yes.
Doesn't look like there's any other questions in the chat, but if anybody wants to raise their hand or unmute, feel free.
I'll just say quickly, great job, Lauren and team. This is so helpful because we're seeing communities across the state, spend the money sometimes really wisely and sometimes not at all, and sometimes in places that I just don't understand. So this is so helpful for them to have some direction and guidance, and you all have done a really good job with that. I did just want to say, Fletcher Group is a rural center of excellence for recovery. We have all kinds of free tools and resources. Like, for example, we have 2 needs assessment toolkits if you're trying to figure out like what does our community actually need. So Lauren, I'd be happy to connect with you later and share any of those so you could use them and share them. We also have a free learning center. A lot of our stuff is focused on recovery housing, but we have all kinds of things that might be helpful. And just something I wanted to comment on, somebody earlier had mentioned possibly getting some services in a jail. And for things like that, I would always encourage, and I feel like it's also any service, to see what already exists in your community, because your local community mental health centers, your nonprofits have been around, they're doing the work, and usually they would probably be more than willing and happy to provide those services, that you may be able to get the service and still use your money to do something else. So I just wanted to point that out. And Thank you all again. This was very helpful.
Hey, Lauren, I know we have time still on the clock, and I look at the people that are on this call, and it's particularly some of our treasurers who are usually not at all shy about asking questions. So if there is something you're thinking of, instead of hitting me and Lauren next week at the treasurers conference, we'd love for you to hit us now while we have our friends from, like Derek and our friends from the AG's office here as well. So if some of y'all have questions, you just weren't sure you wanted to ask, now's a really good time to ask. But you don't have to.
And there will be, we are going to continue it, have this a continuation conversation, where we will be bringing in the partners and having the best, best practices and how to navigate different things and how to connect with the community partners to really help this individual. To help this issue and help these individuals. And yes, there's our contact information. We will be sending out the slides. Also, in the slides, it's a PDF. So not only are you going to have links to those statutes, but you have some examples that you can go and click on. I don't know if I need to wrap this up this early or not, but I do appreciate everybody. And if there's no other further questions, I really appreciate not only this opportunity, but you all taking your time this afternoon and listening in.
Hey, Lauren, I just got a question that was sent directly to me. Could funds be used to help cover the costs, the medical costs related to opioid use? Well, it's moving on me. Related to opioid use on persons arrested who are treated at a hospital before taken to jail. So in other words, what they're asking, Lauren, is if Rich Ornstein got picked up for doing whatever, and I'm obviously strung out, and they take me to the hospital before taking me to jail, could you use opioid use funds for the hospital bill?
I know that they are trying to have crisis stabilization centers. I want to say I think that by July of this year there should be one in every community mental health region, and so that would deter the cost of that. I am unsure for the medical cost. I might have Derek or Kate to highlight on that, but I know that the state is working on crisis stabilization centers. So that would mean, and I believe that all the community mental health services will have one in the region. And so this, yeah, I'm just gonna get, yeah.
Yeah, I mean, right, it's a similar answer to what you've heard for other questions as well, right? If there are other funding sources that could address that, right? If they have Medicaid coverage or insurance coverage or things of that nature, those should be the payers of first resort. But assuming there are not other sources of funds that would otherwise cover that, if it's being used for treatment for opioid use disorder and or co-occurring conditions, and it's likely to fit within that permissible use.
Okay, I think we are wrapping up. Thank you guys for listening in on this webinar, and look forward to more educational opportunities in the future. We have several scheduled, and I, again, am thrilled to be in this position and to be an asset to the counties as you all navigate this process. Thank you all and have a great day.